Thanks for joining us for the 4 o'clock News and Politics Hour. I have Tom Coderre here. Thank you for coming in, Tom.
Thank you, Kate.
Rich history from Rhode Island, went to D.C., went national, addressing the opioid crisis, and you were lured back to Rhode Island.
Absolutely. I was working at the Alterum Institute down in Washington after I left my appointment in the previous administration, and I got a call from the governor one day, and she said to please come home and help address the crisis that's happening here in Rhode Island. So coming home was not in my plans immediately, but the thought of it was very, was very attractive to me, to be back with family and friends and in a community that I love, to try to be able to help our own home state.
And when she brought you back and she said, here's the job description, we know the tall order that states are facing around the country.
Right.
What did she say? We really need your help, Tom, to do this.
Well, the governor, as you know, has been very, very active on this issue. This is something she cares deeply about. She's lost 3 people personally to drug overdoses that she knew personally. So she knows that the governor's office can really be a convening point for people in the community. She used the governor's executive power to set up a overdose prevention and intervention task force. That task force has been going since 2015. They have a strategic plan. They've achieved so many important goals, but the governor knows that we could be doing more. And so she said, Tom, I want you to come home and I want you to help us, to help us figure out who's not at the table that needs to be there, who's at the table who could be doing more, and what are the things you learned when you were in Washington and traveling all over the country? Like, what are the evidence-based practices that we're not doing here that we need to be, and what are some of the other innovative ideas that you might have to bring to the table? So that's why she asked me to come home.
There's so much we can be talking about in terms of what you're bringing to the table here and what you're looking to help here in Rhode Island. One of the ones I want to ask you about is the prison program.
Yeah.
This has been in the news for its innovation in addressing addiction within the prison population.
Of innovative programs.
Yeah, so talk with us. Tell viewers a little bit about the prison program.
Sure. So the program at the ACI is very, very simple. What they noticed at the ACI was that people who were being discharged were overdosing, and many of them dying, quite frankly. So they were fatal overdoses from people being discharged because they'd get out, they would return to neighborhoods or unsafe places where they used to use or with people they used to use. And so they said, what can we do about this? They came together with Dr. Clark at the ACI, with the folks at Buddha, the Department of Behavioral Health Development of Disabilities and Hospitals, and they said, let's design a program. Let's offer medication-assisted treatment to anybody that was discharged. So they sat with the people before they left. They identified the best medication for them. They identified a safe ride for when they left the prison to go to a safe place, a recovery house, or with family and friends who were safe. And what they found by doing those simple things, that overdoses have decreased by 61% in a 6-month period.
Wow.
Big, right?
That's huge returns.
Yeah, it's huge return on the investment. The governor committed $2 million in her budget of general revenue to this program because people who are in prison don't have health insurance and aren't eligible for Medicaid. So this is something that we're trying out as a pilot. Now that it's had such great success, we're going to take it to the next level.
What is the next level?
The next level for that program is getting more folks involved, right?
Okay.
So we've been able to really show its effectiveness. Now to really roll it out to the broader prison population. Maybe folks who are entering prison, get them on the treatments.
Get them in the front end.
Exactly, on the front end. Spend more time educating the folks that are in prison about the benefits of getting into treatment and then finding long-term recovery. What I found myself, I went through my own battle with addiction and I got into recovery, and what I found is that, really educating myself and then having peers who surrounded me and encouraged me to go forward is what was really helpful. So for the folks at the prison, having recovery coaches at the prison, doing recovery rallies at the prison, showing them that they can create a better life, showing them that there's hope, that there's life after addiction. And I think that's what people don't oftentimes believe. They think they're addicted, they think their life is hopeless, they think they're never going to be able to get out of it, and we're living proof that that's not true, that lie is dead.
So let's talk a little bit. You've got so much on your plate because you're dealing both with addiction and addiction recovery, but let's start at the beginning,
Sure.
The preventative measures, because we've seen so much locally, nationally, how people can get into it from a myriad of angles. We see people addressing even the pharmacological aspect of it, but from the we'll go baby steps. We'll go through for everything that's on your plate. How are you addressing the preventative side of things?
So the Overdose Task Force has 4 working groups right now. One is prevention, treatment, recovery, support, and rescue. So we know that those are the four main pillars that we really have to focus on. The prevention pillar is a really important one, as you mentioned, and the Overdose Prevention Task Force is, when they say prevention, they're talking about improving prescribing habits primarily, like going upstream to say if we can prevent people from getting addicted in the first place, we'll be far better off. Those are the easiest people to save, right? Then we also have primary prevention. We have to go into local communities, we have to go into schools, we have to be using evidence-based programs to make sure that kids know the dangers of drug use and also have safe alternatives, right? Safe and sober social activities, other kinds of things to do to keep them from getting involved in addiction. We know that 10% of the population approximately is predisposed to addiction for genetics or environmental factors, so identifying those folks early who are at high risk and make sure they have programs. We've also gone out to the cities and towns and through a grant through the Department of Health, and Dr. Alexander Scott, who's been doing an amazing job with my other co-chair on the task force, Director Becky Boss, went out into the communities and they gave grants to each community to develop an overdose prevention plan in the local community.
So they have the local control
That's
over there as to
correct.
what partners they need at the table, how the outreach efforts happen.
Exactly. So that's going to do a lot for prevention too, because that's being done through the local prevention task force.
And so let's talk about treatment. Let's go through the pillars because
Absolutely.
You've clearly identified the buckets that need to be identified.
Sure. So the next pillar is rescue. That's really helping people, and I did them out of order. Sorry. But the next pillar is rescue. Rescue really involves making sure that anybody who's overdosed has access to the life-saving antidote called naloxone. Naloxone can be obtained in a liquid form that can be administered by first responders, a nasal form, which is really easy for the public to be able to give it to a family member or a friend who might be overdosing, and there's also auto injectors as well that walk you through the whole process. So someone who's not used to the technology or the medical devices could actually very easily provide naloxone to somebody. So making sure that rescue is involved in each of in all of the everywhere we can have rescue efforts, have them. There's a thing called Nalox Box. I don't know if you heard about it, but there's
We've had it on the show before.
Oh, you have?
We
All
have.
right.
Molly has had it on the show.
So people know about it here, but that's a great idea, right? Taking a technology that already exists through, like when we see defibrillators in every public building.
Yes.
Why don't we have naloxone in every building? So that's the rescue part. Go to treatment. The treatment pillar, very, very important that people, number one, get diagnosed with a substance use disorder. So a lot of times we're not diagnosing people and people don't know. Their family members, their friends know there's something going on with them, but do they have a mild, moderate, or severe substance use disorder? And then what level of treatment actually can help that individual? So do they need, maybe some people might need some counseling. Some people might be good for candidates for outpatient counseling. Some people might need partial hospitalization. Some people need residential treatment. And then we have the gold standard for opioid use disorder, which is medication-assisted treatment. There's 3 FDA-approved medications for opioid use disorder. We need to sit with the patients, just like we're doing at the ACI, and say, what works best for you? And make sure that those medications are offered to them and that they're paid for, too, that they're affordable. So that's the treatment side. And then there's recovery support, my favorite side, because I think for people in recovery, again, the hope that comes from sitting down with somebody else who's in recovery, sharing your story and supporting each other is really important. So we're seeing recovery coaches in emergency departments. So when somebody shows up in an emergency department after an overdose, they're not just talking to a triage nurse, but they're talking to somebody who actually was in that emergency room and had overdosed themselves, been through the experience and knows how to get to the other side of it. That's one thing. Community centers, like Anchor Recovery Community Center, amazing project. The Parent Support Network, who's working with families who have been affected, and also doing a recovery coaching program of their own. And then we saw the Providence Safe Stations project, which kind of goes across all of the pillars.
Yes.
But Providence Safe Stations is great. You can show up at any fire station in the city of Providence, and within 15 minutes, they'll have your vitals checked. They'll make sure that you're not in any danger, and then they'll connect you with a recovery coach who can help you navigate what is sometimes a cumbersome system. So,
can we turn the tide?
We can, absolutely. Not only can we, but we are. There's some they're modest decreases, but they're very encouraging numbers that we're seeing. 8% decrease 2017 over 2016 in the number of overdoses in Rhode Island. So that's important. This is the first year that we saw a decrease in those numbers. For the last 5 or 6 years, they've been going up. and finally we're seeing them come down. So we not only can we, but we are turning the tide, and we're not going to give up. This is an all hands on deck effort. We're having everybody in the community be part of this. This is not just for the governor important. It's important for mayors and cities and towns. It's important for law enforcement. It's important for hospitals and other community partners. It's important for us all.
Now, has the president declared a national health emergency, a de facto
Yes.
one, or is he? What's the status of that from the administration?
So that's a great question, Kate, and not getting too political here. I mean, I think one of the things that we're seeing from Washington is we're seeing a lot of talk. The president did declare a national public health emergency, is what he declared. And he ordered the HHS secretary to actually declare the emergency, because that's who has to declare a public health emergency.
Okay.
But we haven't seen anything implemented. We haven't seen new resources come about as a result of that public health emergency. The president did have a task force,
Yes.
an opioid task force, which has been great.
Former Congressman Patrick Kennedy.
Our own Patrick Kennedy sat on it, but then Patrick Kennedy released something a few weeks ago that said he wasn't happy with the results of the task force. So they had 56 recommendations. They only implemented one, which was to declare the national emergency. We need more. We need more
So
effort.
there's 55.
There's 55 left. So Congress has identified $6 billion over the next 2 years. We're waiting to see what the details are on those. We're hoping that those 55 recommendations from the task force start to get implemented with those resources.
And speaking of resources, what will you be having conversations with legislators about that will potentially be either standalone bills or in the budget?
Sure. So we're talking with legislators about a couple things. There's a project called BH Link, which is going to be a crisis center, so that we can divert people from emergency rooms to an actual facility that will help that person navigate all the kinds of services that they might need.
Is this a best practice nationally?
It absolutely is. It absolutely is. And what we can do is take that individual and make sure that they get hooked up with community providers. What we're having trouble with, I think, is that people go to an emergency room and they go somewhere and they don't get the right referrals. They don't get connected with services. So when they leave that provider, they don't know where to turn next, right? So we need to wrap around these folks and really help them.
Would this be a standalone facility? So instead
Yes.
of going to Rhode Island, instead of going to Miriam, would it be if an emergency vehicle picks someone up that they would know to bring them there?
Precisely.
Okay.
That's exactly what would happen. Bring them right to that crisis center. Help them again get their life back on track. From soup to nuts. What do they need? Right. Assess them. Meet them where they're at, and then get them the help that they need.
Do we know where this would be located?
Not yet.
It's too preliminary.
Too preliminary.
Okay.
We're working on it right now. We're hoping that over the next couple of months we'll start to be able to announce some of the details of it, but it'll be great. We're also working, the governor has in her budget a recovery jobs program. I don't know if you heard her talk about it in her State of the State, but Governor Raimondo talked about, listening to Jonathan Coderre, who was a person in recovery. She said to Jonathan, what helps you most sustain your recovery? And he said, actually, having a job. Now that might seem, right, pretty simple to most people, right, pretty elementary, but for people in recovery it's hard. Some of them have criminal records, some of them have been through a lot in their life, some of them need help, they need support. So this recovery jobs program would use the Real Pathways program at DLT, create a pathway for recovery. Identify recovery supportive employers, identify the kinds of services that people would need to succeed in the workplace. Some of them may need job training or education, or even other simpler things to really be a success in their job, but finding out those kinds of things that they need and providing it to them. If they have a job, they're more likely to sustain their recovery.
And how difficult is the recovery process to sustain it? Because the temptation's always there, and we hear about the cases of people who've gone through treatment, family members
Sure.
think that things look good, it just takes one time.
Well, what we have to remember is that addiction is a chronic disease, right?
Yeah.
But it has the potential for recovery, which we know, but it also has the potential for reoccurrence. Just like a lot of other chronic diseases. Diabetes is no different. Heart disease is no different. You could have a reoccurrence of the disease, and when you have a reoccurrence, that doesn't mean the person's bad. That doesn't mean that they did something wrong. It means that they actually have confirmed their symptoms, right? And so what we need to do is make sure that those people get back into treatment, get back on their feet as quickly as possible. Is it hard? Yeah, I mean, recovery can be a hard thing. It's something you have to do every day for the rest of your life, but it's like treating any other condition.
And you're focused, on again the opioid crisis here. You talk about law enforcement and the drugs on the street.
Sure.
How much do you work with them to say what's out there? What are you seeing? What are you grabbing? What are you getting?
There's, so the folks from Rhode Island State Police, Colonel Suppico, and her staff, she just assigned Sergeant Michael Moynihan to the task force, so he's working very, very closely with us now. We also work closely with the HIDTA folks and the Fusion folks, the high intensity drug trafficking folks who are working through the DEA. It's really an incredible partnership that we have with law enforcement right now. Because I'm only been here a couple weeks, I'm not really versed on exactly what they're doing, but we're going to see them actually this week to learn more about them.
So what will we hear next from you and the administration for steps moving forward? We saw a lot with the prison program.
Sure.
Here we are, we're entering March. What's next?
Yeah, so I like I said, I foreshadowed a few of the things that we're doing. There's going to be lots more, but we really are going to stick to the strategic plan. The strategic plan was crafted by the community. We think it's a good plan. Are there ways we can light a fire under some parts of it so that we start moving a little faster? That's what I'm for, right? Now, my job is to help people coordinate and stay on top of things, and really say that this is still urgent. There are still people dying in our community, way too many people, and so we need to act with urgency.
Well, I appreciate your taking the time to come in here. I know you've been
pleasure.
Busy getting your feet wet back in the state, again, the homecoming. But Tom Coderre, I appreciate your coming into the studio.
Kate.
I'm sure we'll talk
Thank you.
soon.
I look forward to it.
Okay, I'll let you go.
Take care.
Okay,
Bye-bye.
thanks. Tom Coderre came back to Rhode Island just a few weeks ago to work in the governor's office, again, focusing on the opioid crisis. He comes with a magnitude of federal experience, having worked in the Obama administration, worked for a nonprofit after, and now back here working, as he said, on the 4 pillars of working with addiction and recovery. Appreciate Tom taking the time to come into the studio. Don't go anywhere. We'll be back with our next guest here in the Navigant Credit Union Broadcast Center.